So let's keep the conversation moving and shift it to talking about collaboration, partnership, how the system is changing, and some of the difficult conversations that are needed as part of that as we all try to move forward in behavioral health. To lead us through that conversation will be Carol Burton. She is the new Behavioral Health Care Services Director in Alameda County. A great mind in thinking about how to stay on the front end of the curve related to behavioral health and move it forward to ensure that our populations are served in the best way possible in every county in the state. And so, ladies and gentlemen, Carol Burton will lead us through this conversation. Carol.
Thank you. So, first of all, I want to say that it's a pleasure to be invited as a behavioral health director. I am a member of the California Behavioral Health Directors Association, and it just feels good to be moving in the direction where we're actually working collaboratively on addressing some of our most pressing issues as it impacts our constituents who are suffering from mental illness and homelessness. So it's the first example of partnership and looking across the aisle and working across the aisle to address some of these challenges. So I want to start first of all, say thanks, and to say that Colleen Chava is the Healthcare Services Agency Director, and she did come from San Francisco. I'm actually the interim director of Alameda County Behavioral Health Care, and I've been there for since October of 2017. I'll probably be there another year or so. We'll see. But one of the reasons I am I think uniquely qualified to facilitate this wonderful panel. I came from a place where New York State, where we operated programs in 21 New York State prisons and also Rikers Island. And then in the Bronx, or the borough of the Bronx, and also Brooklyn. And to do most of that work, it required some really tough collaborations, often working with people who had opposing organizations that had opposing missions. Of course, when you think about prisons and jails, you think about care, custody, and control. And when you think about government, we think about safety net, providing services to the most vulnerable folks. And so in the nonprofit world, when we're all kind of driven by the notion that we want to make the world a better place, and we want to be the heart in many ways of our communities, sometimes we find ourselves in challenging situations. So I think Barbie left us with a nice segue to this conversation, and her suggestion that we actually look at partnering with others to address these really challenging issues. So I have with me, let me say a little more about some of the work that I've been doing since prior to joining the county. So my corporation provides consulting and technical assistance to government agencies and nonprofits who are interested in really improving their responses to and for the populations that they are intending to serve. And most of the nonprofits, which we've worked with about 120 so far across the state, and also the state of Michigan and Maryland, most of them are poorly organized and really ill-prepared to operate in the system, managed care system, in a changing environment such as the mental health, specialty mental health field. And so what I find in government, however, on this side of the aisle, is that we rarely speak the same language. And so we're not speaking the same language as the nonprofits. And so as we start to ask and demand more of our nonprofits and the folks who provide the services for county government, there is a disconnect. So here we're going to talk with both Karen Larsen and, looking at you. We're going to talk to Karen Larsen and also Margaret Kisliuk. who are going to give us some information around their experiences, what their interest in this issue is, and also if you can just end your introduction with what inspires you, what gets you up in the morning, what really rings your bell.
I really appreciate the opportunity to be here on behalf of Partnership Health Plan, but also on behalf of myself, because I feel really, really strongly about our work with the counties. And just a little bit of background on Partnership Health Plan. We're a county organized health system, which means we're the only Medi-Cal managed care plan in the counties we serve. Our board of directors is made up of appointees of the boards of supervisors of each of the counties, includes Karen Larsen and 34 other members. So we basically consider ourselves part of the counties in a way that we work very closely with the counties, mainly with the Health and Human Services directors, but with many others as well. Just a slight detour to my background, I worked for many years for the city and county of San Francisco, and I know sometimes they think they're a city, and sometimes they think they're a county, but the work that I did was almost all in the healthcare sphere, in which case we were a county. Then I also worked for the Marin County Department of Health and Human Services, and some of the work I did for San Francisco was in Sacramento, so I worked a lot with other counties. When I came to Partnership Health Plan, it was right after the adoption of the Affordable Care Act, and I was in their Redding office in Shasta County working with the 8 counties that had just been added to the network. So there was a lot of work. It also happened to be the same time that the state had started to provide, that asked us to start to provide the mental health services for those with mild to moderate treatment needs. So there was a lot going on at the time I started. The reason Partnership was even able to serve those counties up north was because the counties came together and advocated, and as I've been told, fought pretty hard with the state to have a Partnership Health Plan and probably as importantly, one managed care plan in these small counties with small populations where resources are limited. When the state, so Partnership Health Plan, in part because of the time that we had to get the benefit up, has been administering the mild to moderate mental health benefit through a provider called Beacon Health Options. And we have been pushing them very hard to expand services, and actually within Partnership, we have the highest utilization of Beacon services statewide, and they're in 26 counties. We're at about 8 to 10% penetration rate, which is pretty high for that service. When the state announced the waiver to provide substance use services and to made it a county option, I want to very much second the comments Barbie was making about the model, and the counties up north came together and said, we don't have the resources to do this. We want it to be integrated. We want it to be part of the overall healthcare system. And so they came to us and asked Partnership Health Plan if we would provide this on a regional basis, which has been a very interesting conversation with the state because they had set up a model that was county-specific, county-funded, and I could go on and on, but I'm going to try to stick to the introductory remarks and just say that a lot of my work is working with the counties, one, on how we work together on the mental health benefit, because that's critical. If the services are divided between what we do and what the county does, and we need to work closely together and cooperatively. And I'm proud to say that Partnership has never felt that we needed to go to the state dispute resolution process. We've always been able to work with the counties and resolve any case discrepancies over the care of a case. And then the other part of my job is working really closely with the counties, including those that are doing the ODS waiver on their own, meaning doing the substance use benefit on their own, to make sure that we're providing as much as possible an integrated benefit. And that's what gets me up in the morning. I want to get services to the folks that need them. I don't care whether it's part of the Partnership Health Plan mental health system or substance use system, or whether we have to do some work around. I just want to make sure that the folks on Medi-Cal get the services that they need. And I've been given a lot of latitude, at least to me, and it's been very exciting.
I'm Karen Larsen. I'm the Director of Health and Human Services for Yolo County. I also wear the hat of the Mental Health Director and the Public Guardian, which is kind of important to the conversations we're going to have today, I think. I have been in this work for over 25 years now, and 20 of that has been in Yolo County. I know that's shocking based on my youthful appearance. The first couple decades of my work was not in the county system. I was actually worked for nonprofits for years and specifically in federally qualified health centers. But for the past 20 years, I've been in Yolo County, and the way I landed in this job is because I was one of the most outspoken critics of our mental health system locally. And so when we lost our last mental health director, which was our 8th in 15 years, they asked me to be on the interview panel, I think a little bit to shut me up. And so I sat through a whole day of interviews with several people from many of your counties and said, oh goodness, we can't hire any of those people. They're like C+ at best. And we're heading into this time of change. We were just about to have the ACA was about to roll out, and please don't hire any of those people. And so they said, why don't you put your money where your mouth is and come to work for us? And it was not a very appealing job offer, I'm not going to lie, to leave a nonprofit world to come to work for the county, who I felt like was a little bit the enemy. But they had a couple things going for them, one of which was a county administrator who is in the room and happens to be my boss. So a lovely human being, who I will say his mantra is just do right by the people and everything will be okay. And so you can't go wrong. Doesn't mean I get all the money I want to do that, but does mean he supports what's right for the people we serve. And they were getting ready to integrate 3 departments: the Alcohol, Drug, and Mental Health Department, the Public Health Department, and the Department of Employment and Social Services. So to me, having had to help people that were pretty compromised navigate 3 separate systems and go through 75 hours of intake paperwork and blah, 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 to think about the benefits of an integrated system was pretty exciting. For any of you that have ever worked in community clinics or FQHCs, they kind of have their own little microcosm integrated systems, right? So we did dental and prenatal and behavioral health and substance abuse and all of that all in the FQHC I came from. So to think about the county operating in that way was pretty exciting. Shortly after we integrated, the agency director left relatively unexpectedly, and I got the offer to take over the agency. So when I think about the things that excite me, I think part of the reason I landed in this spot, I know it's my life's work to build bridges across systems. It's totally my jam. I love, working with my friends with guns to figure out how to get people out of custody that are mentally ill, or, I oversee child welfare now, so redesigning that system in a way that's more focused on the safety of the children we serve. Those are the things that get me excited, and that's why I love my job so much, in addition to having such an amazing boss.
Is your boss in the room? No. No, okay. So I guess I want to start with one basic question. Why is it necessary for us to have partnerships? Why do we have to work across the aisle? Why do we have to walk across the aisle? Why do we have to have difficult conversations about things that seem obvious? Supporting people who are mentally ill, providing services to our most vulnerable and fragile populations. Why do we have to have these? Why are these partnerships so essential?
For us in Yolo County, we're just over 200,000 residents, so we're the kind of smallest of the medium. I think Napa might actually be medium now, but so when you're small and you're relatively poor, we have very little revenue compared to a lot of counties. You have to work across systems in order to maximize revenue. I think Supervisor Zane had asked, how do you fill the holes with the funding? And this is the way you fill the holes. You work across systems, you figure out ways to match funding, you have an integrated health and human services agency where you can braid multiple funding streams to best serve the people. To improve child welfare outcomes, to improve homelessness, you have to work with your cities, you have to work with the courts, you have to work with people outside of your system in order to improve those outcomes and to maximize your revenue.
So let me ask you a different question, Margaret. So can you give us a specific example of something that was really hard, a partnership or a collaboration that you were successful in, or maybe not?
Well, the examples that spring to mind, although I have several, are the eating disorder cases, because those are sort of the classic, how much of it's physical health and how much of it is mental health, and how much of it can you not deal with if you're only talking to the person affected. And so we had one case, it was a very ill adult, and that for eating disorders, that makes it 10 times harder, in Humboldt County. And the county basically, the behavioral health folks, the individual was in the hospital. He wasn't eating, so he was on a feeding tube, which means no mental health facility would take him for inpatient care. And we had a lot of conversations with the county over, and the problem is that one of the things that makes this difficult is you're not really talking about money, but it sounds like you're talking about money. Because we're having these conversations about who's responsible. Is it the county's responsibility, but he's in the hospital? Isn't it our responsibility? And the fact that the county, that's not what they do. They don't monitor somebody in an inpatient general acute unit to see how well they're getting. And it was a very difficult thing. And of course, in the end, there's never one answer. You can't say, oh, your problem is this much physical health and that much behavioral health. And we ended up just coming up with sort of a cost-sharing arrangement, and goodwill. Because the other danger is that you get gets tense because the county doesn't have a lot of money. We don't have the wherewithal to monitor the serious psychiatric conditions, and so we did. I don't want to say it was a success for the individual because he was very ill, but we did get him into the appropriate treatment facility. We did work it out and did not endanger our relationship with the county. But I think the general thing that the funding is one of the reasons we work together, besides that we like each other and everybody's wonderful, is that the funding is split. Inconveniently, individuals don't come to us with, oh, this is my behavioral health problem, so I'll see you, and this is, oh, well, I can separate this is my, they come as one individual, and they need care. And the other thing is, and then I'll get a little bit off my soapbox, is if we don't treat the behavioral health needs, if somebody doesn't treat the behavioral health needs effectively, it's going to cost the plan money on the physical health side. There's significant data that show if we do substance use effectively, if folks get treatment, our emergency room costs, our inpatient costs to the plan are going to go way down. So the fact that the county would be spending all the money doing the substance use care, and the plan would be getting all the savings from the folks not going in the emergency room, it's not exactly that simple, but that's sort of an example of why the disparate funding makes it important to work together.
Karen?
So I'm going to talk about homelessness a little first. I think that our current conversations with our city partners are difficult to navigate. I'm sure no one in the room relates to having troubles communicating with their cities about homelessness. I'm sure it's only in Yolo that they're pointing at us, saying that we're not doing enough, and we're pointing back at them in a similar fashion. So we've taken to getting all our city managers in the same room and kind of trying to talk about the different funding opportunities that are available. And, 2 cities want to apply for No Place Like Home, but the application comes from us. How are we going to navigate that? Do you base it on your homeless count? Do you base it on who you like better? So we are having those discussions, and they are not always easy. And I think it takes a level of risk from the county perspective when we do have limited resources and all of the housing development, because that's where we all need to head. In case anybody missed the memo, that's how you solve homelessness. As we move towards having more housing and all of that housing requiring services then there's this additional responsibility on the part of the county. And so there's, the conversations are they are difficult because it's hard to commit to 20 years worth of service when you're not sure how you're going to get paid for it. I don't think I have, I think the conversations around the criminal justice table have become easier over the years. I will say, I think the shift was less about the realignment than it was about people around our CCP table having their own personal experience with mental health in their families, and then realizing that maybe that is a pretty good thing to address as a system. Maybe they aren't just criminals. And then I think as we, when I think about conversations that we have as mental health directors statewide about the carve-out, and those conversations aren't easy. I think are those of us in the room who have partnership, for example, as a managed care plan that would love to have the carve-out go away and hand over that responsibility to partnership, because honestly, they're much better at managing care than we are at the county level. But that, for some behavioral health directors, is blasphemy. The thought of handing over this protected pot of funding feels like sacrilegious. So it's a difficult conversation when we get 58 counties in the room and have those conversations.
Definitely, and particularly because all of the counties have different resources and different amounts of general fund that may support or not support their counties. I think the most difficult conversations I've had have been around the complexity of specialty mental health. And so as you look at people who are on the streets, homeless, and then all of the 14 cities, and I think about 11 unincorporated areas in our county are all saying, they're your problem. And then I'm looking at my health provider or health plan, and they're not in the room, but it's only us. And so trying to explain it's a long process, so it's never over. And I would say that one of the challenges of this particular role is understanding the complexity of the funding and the managed health care plans. So most of my difficult conversations are not over. You said that criminal justice is easier for you. It's always public safety is always an ongoing, challenging, difficult conversation. But how long, in some of those instances, how long has it taken to really get to alignment, where you feel like you're on the same page with a partner that's needed to move the agenda ahead?
So in thinking about criminal justice reform, I think, we have had several iterations over the years since AB 109 and probably even since Prop 36 and before that, right? So I think we started with small collaborations or partnerships like drug courts and those kinds of things. And over the past year, we adopted the Stepping Up resolution. We had our Board of Supervisors prioritize criminal justice reform, a coordinated kind of system locally in their strategic plan. And we did intercept mapping in Yolo County. So for those of you who are familiar with the Stepping Up initiative, it's a nationwide movement to reduce the numbers of mentally ill in custody. And intercept mapping essentially breaks up the criminal justice continuum into 5 different intercepts, from initial incident with law enforcement all the way to release from custody and community corrections. We created groups for each of those intercepts that met monthly, and they included people that worked for the county, local law enforcement, CBOs, the courts, and they all came up with gaps at each of the intercepts and potential solutions in each of those intercepts. There were more than 54 of those. And then we had to prioritize kind of what we as a county were going to choose to address. We actually had a separate intercept working on information sharing, because that seems to be, we can't even get baseline data because we can't all talk to each other between systems. After we got this prioritized list of gaps and solutions, a separate group that was made up of participants from each of those intercepts got together and formed a grant writing group and started working on grant proposals to get funding to address those gaps. And it's actually led by the district attorney's office, which is kind of amazing, I will say. But just what I hear about other district attorneys' offices, I'm thinking that might be a little unique. So it's been amazing because it forced us all to work together. We all had this common goal. We all agreed that people struggling with mental health issues probably shouldn't be in custody or should have shorter lengths of time in custody and those kinds of things. And it's amazing. I mean, we're still going down that road together. It's not always easy. The district attorney doesn't always agree with, my soft heart, and I don't always agree with their sentencing procedures. But I think we find common ground and work towards it and get a little better all the time.
Mm-hmm. How many folks in the audience have participated in the SIM mapping process or signed on to Stepping Up? And so how many of you have had difficult conversations? Yes. So I want to say that that's something that's not done yet. We have renamed our SIM process to, now it's called the Justice Involved Mental Health Behavioral Health Task Force. And we do have all the players at the table, the sheriff, the DA, public defender, and our most robust conversations are around data sharing. And robust, and I'm being nice, the conversations are hard and difficult, and law enforcement has their data, and behavioral health has their data, and so whole person care is somewhere in the middle trying to pull it all together. So what's been the timeline on some of your most challenging conversations, Margaret?
So we've been working, we meaning Partnership Health Plan and the 8 counties trying to do the substance use model as a region, have been working with the state on our fiscal model for over a year now.
Whoa.
And we're still not there. And a lot of this has to do with the two parts of the state talking to each other, to be honest. The behavioral health folks talking to the primary care folks, and a lot of it has to do with the peculiarities of realignment funding and managed care funding and all that, but I'll let you know when it's over. I will say, in working with the counties on the mental health benefit, it started out difficult. We have 14 counties in our system, and we could have ended up with 14 different sets of screening tools and ways to do things, and there was a lot of distrust in the beginning, and I think that's working much better. I can't think of a county where we don't have goodwill. Mm-hmm. And a sense of trust that we're not trying to get out of the responsibility, we're not trying to offload folks, mm-hmm. and vice versa. And that probably was accomplished in about a year.
Mm-hmm. Mm-hmm. So it's difficult to keep your eye on the ball when it takes 12 months, 2 years, sometimes 14 years, God forbid. Most recently, we were successful in after about 2 years of conversation, of getting an RV on the property at our county jail, at the largest jail. And it was an RV to kind of catch folks who were not necessarily stopping and saying, listen, I need help on my way out, or we weren't able to access before they left. And there was just a great deal of pushback and tension. And we weren't really clear. We were trying to have the difficult conversation. But one day, it opened. And so here we are almost 36 months later. The RV is there, and nobody really understands why we didn't put the RV there. And so there was a reason in the beginning. So frustration sets in, and sometimes bitter feelings. And so it's really difficult to move forward. Can you really talk about the cost of some of those long, challenging, avoiding those long conversations or difficult conversations, and or what's been the cost for the beneficiaries, for the county?
When you're in a small county, everybody knows everybody, for better or for worse. Mm-hmm. So sometimes it's not always for better, but we all know each other. We kind of all know our community pretty well because we're small enough. I mean, we could all name off our top 20 utilizers, and many of them would be exactly the same humans. So I think and we're still all protective of our resources because we're not terribly wealthy. So I think we've been pretty successful in matching funds whenever possible. We match funds to our city partners on homeless projects. We match funds between our Health and Human Services Agency and our CCP in terms of behavioral health services for Medi-Cal. They provide, basically CCP provides the match for our Medi-Cal recipients that are probationers receiving services. So I think whenever we at the county level can find partners that make sense and find a way to match the funding, then we grow our resources, right? I think a lot of counties fail to utilize IGT or MA as revenue sources, and there are millions and millions of dollars that are untapped. And so I think maximizing the revenue that is available to us until we get to a system that pays us for what we deserve and what we do and pays us for outcomes instead of widgets is the short-term answer to filling the holes.
Mm-hmm. And I also think some of the cost could is in wasted time that clients do not receive services. We spent about 3 years with probation trying to figure out how we could serve in their offices clients who were mentally ill, and a structure that we can maximize resources. And until we were able to help the leadership, changing leadership, understand how we needed to structure that to be able to maximize and leverage revenue, we were not able to provide the services because, of course, they had a particular way that they wanted to see it happen. So sometimes it delays getting services to the very people who need it. What's been your experience, Margaret?
Well, I think this again has to do with, I think, the goodwill and the trust between the parties, because our main issue is it might take time to resolve the issues, but in the meantime, there's an individual who needs care. So trying to make sure that they're at least getting cared for, sometimes in the county system, sometimes in the partnership system, is critical. And another thing, at least in the course of time I've been at partnership, which is almost 5 years, I feel, and of course it's due to my, it's not all due to my influence, but I feel like partnerships really learned a lot about the counties and about how to work with the counties. When I first came to the plan, the new counties that were coming in were saying, wait a minute, you're not going to pay us to do immunizations, which is a fairly standard thing to do in a public health department. And we were saying, the plan was saying no, because we want it all done by your primary care provider. And now, of course, we're realizing, wait, we have all these people are not immunized, especially the kids. Anybody doing it would be good, and why don't we just make sure we get the data, which was sort of the issue. I think one of the things that's particularly difficult with behavioral health, and that I think needs to be emphasized on our part to understand the counties, is the differences in how we're funding. Mm-hmm. Realignment is more or less a set pot that's counter-cyclical. As need goes up, sales tax revenues go down, and so it doesn't match need, and it doesn't necessarily, I mean, even outside of the economy, it doesn't match need. That's not how managed care plans are paid. I mean, we could quibble quite a bit about we didn't get our just desserts, whatever, but our payments are based on analyses, national analyses of cost, and our experience with cost, and so they do flex to some extent with the need. And I think enforcing that at the plan side, that we could get mad as we want that the counties are not stepping up if we think they're not stepping up, but we have to also understand the context in which they're working, and it's not quite the same or perhaps as fair in some ways as the one that we work with. And I think it's important to keep things like that in mind too if you want to move together and figure out how to address things.
Mm-hmm, mm-hmm. I think some of my most challenging conversations most recently has been around homelessness and the Mental Health Service Act funding. How many of you have had those conversations? And I think the real challenge, and I think that what's still out there in the universe is that the funding can be used for just about anything. And I think the having pressing through to have those ongoing, continuous conversations, finding ways to educate your constituents and your partners, which sometimes are your county supervisors, sometimes they're the departments within the county, and other times they're the stakeholders in the community and your providers. So I think the crux of this panel is really why is it so important? You know, why do we have to push through? And you know, what are really the crux of why we need partnerships? And I think at the end of the day, I think that will keep us going. But for the audience, and I'd like to bring them in this conversation too. Can you kind of share some thoughts, and we'll lead them in a conversation around why this is critical?
So it's interesting. Graham and I were having a conversation. It's kind of been going for a few months now, but it feels like now more than ever, behavioral health is at the crux of every major societal issue that we're facing statewide, nationwide, right? Like whether it's criminal justice reform or homelessness or child welfare, it doesn't matter. Behavioral health is absolutely in the middle of it. And it's not just mental health, it's absolutely substance abuse. For us, 77% of our people in custody before Prop 47 were there for drug-related crimes. 75% of our child welfare parents are there because of substance abuse. So it's at the core of everything we do. And statewide, over the past 3 years, we have lost more than 70% of our mental health directors. So that's a lot of change. Mm-hmm. And so you have all new people in all of those positions, or a lot of people go between counties, but still a lot of change. And every time you get a new mental health director in your county, they probably have different ideas than the one before. And that's what we experienced in Yolo. We had 8 and 15 years, and every single one threw us farther and farther into the hole financially. And not to mention, 40% of our staff got laid off in 2009 along with everybody else. So I think now more than ever, as we move towards whatever's going to happen with the waivers, as we face these major societal issues, we have to partner to address those. And yes, MHSA is a more flexible funding stream than our Medi-Cal dollars, and it can't all be used for homelessness. So how do we work together to grow the funding for these issues that we're facing, whether it be writing grants or taking a more integrated approach to addressing these societal issues? But we have to work across the systems in order to address them. We can't do it on our own. Behavioral health cannot continue to function in the silo it has for years.
Mm-hmm.
And I don't have a lot to add to that, except that, the issues and the reasons we can't spend more flexibly are not just at the state level, of course, but sometimes if you start with the premise that this is what we need, now let's figure out how to work the money to address it, it sometimes gets you a little further, but it's always going to be difficult, and there's always going to need to be advocacy and some flexibility where possible.
Mm-hmm. So I think the major another major concern for at least Alameda County is keeping a qualified workforce, and we lose employees often to other counties who pay more, and that some of them are in the room. But keeping a workforce that can afford to live in the county. And then when we look beyond that for our providers, which in Alameda County, 90% of our services are contracted out. So we look at providers outside of the telecares of the world. Those providers are not paying their employees enough to live in the county. So there are long commutes. So I think that in front of us are real workforce challenges. And we have to collectively figure out a way to deal with that or address it. I think also, because I come from that world of trying to build the internal capacity of government organizations, but also nonprofits, I think building out the capacity and the structure for the government if we're going to continue to be in the business of providing mental health services, especially mental health services, then we need to build out our infrastructure. and build our capacity to be able to do that in a way that's fiscally sound and contractual, and so that we meet our legal and contractual obligations. So I would ask the audience, we have silos, obviously. We've heard it today on this panel. We've heard it earlier. If you have any new information about how the silos came to be, feel free to add that. But what are some of your ideas around our pathways out of this?
So I'm relatively new being a board of soup, so here I go. I just believe it's because no one wants to give up power, and you have to know how to compromise. And it might mean in a silo that you might not get the funding that you're accustomed to. And you have to be a grown-up at the table. And so anyway, that's my perception of why that is, and that we need to understand that we're supposed to be there to help people, not ourselves.
Okay. Thank you, Monica.
I think two things. I think as a behavioral health director, when I started, I understood that I came from the Department of No. In my county, we were seen as always the people that said we can't and we won't, and so we didn't go to the table. It feels important and essential for us to be at those tables, even if we can't say yes to everything. I think in my county, if you start, we get really bogged down in the finance part of it, I think, to the discredit of really the values, what are our core values as all these different organizations. I was told by my former sheriff that they weren't a country club and they didn't want services in the jail. And so I just thought, I bet there's another way to talk about it. So I said, when you have people that are incarcerated, what's the worst thing that can happen? He said, if they're bored. So I said, how about we come and provide services for your bored people? And he thought that was the best idea. And so it's the same, it's just learning how to find a message that works with different people and having a vision that is related to your core values about working with people. And then when it's not working, you don't get to quit. You don't get to complain. You have to then just find your partners and say, I'm stuck here. How's it worked for you? And keep at the mission.
I think that is critical. You have to stay on course, keep moving forward. Collaborations are challenging. They're not easy, but the results are why we're moving in that direction and why it's necessary. Supervisor.
I think there's two things that you can do. As county, I'm speaking to the county supervisors right now. County supervisors, we can help break down those silos by bringing together the directors of the various departments and giving them a task to work together. Because when they can accomplish things together, they actually feel very satisfied with their jobs. I'll give you a very quick example. We had a homeless issue with our water agency because we have to keep the tributaries and creeks clean in terms of water supply. So our water director said to us, and we're directors also in the water agency, how can we help? How can we address this? So I said, well, let me get some of the partners together for a meeting. So we had the sheriff's department, we had the sheriff, we had the regional parks director, we had the water agency, we had the Department of Health Services, Department of Human Services, got all of those, the county administrator's office and the Community Development Commission that does homelessness, got them all around the table and said, what's the problem here? We have a short-term problem of these encampments and all of the trash and everything else, human waste that was going into our water tributaries. We had a long-term problem in terms of housing the homeless. What could we do in the short term to help that? We said, let's work together, provide a multidisciplinary team called HOST, Homeless Outreach Services Team. So HOST now has been in effect for the last 3 years. They work well together. We have a nonprofit contractor, also Catholic Charities, and then our youth contractor. They go out to the people because what was happening was that we were expecting those people who were chronically homeless to come to us. And that doesn't happen. Once they're chronically homeless, they eventually get cut off from services. So we took that host team and we put it together, and now they're going to them. So I think, again, I'm saying real leadership convenes people. gets the directors and the leaders in your counties to come together to work on real solutions for the problems that you're facing.
Thank you. And I think that there's something that you mentioned that's important to raise up, is that when we have successes working across silos, working across departments, we need to celebrate those and raise them up, particularly as we move from the next new challenge, because there will always be challenges. But highlighting and celebrating successes and wins are important. And really kind of being deliberate about mapping out the steps that it took to come to a conclusion or an end that benefited everyone. So really raising those up.
Bill Zizek with KPMG. One particular county we're supporting, about 2.5 million population, very fast growing. They've seen a lot of success in their kind of multidisciplinary team approach for homeless with the cities. And the concept was, let's take that same model to other subpopulations to get other departments involved. Now, it might not have the same political import, but the thought was, in many cases, once leadership charters that, they also need to get out of the way. The department heads need to get out of the way so that the assistant directors and the deputy directors can get together and actually make things happen and have the freedom to come up with creative solutions, bring those to the table, and often have a voice directly with an executive office or a board. And so that's risky, often for some agency heads and department directors, but that's worked very well to get folks engaged and start looking at other areas, not just at the most acute areas that are most publicized.
I have a question. This is Farah McDade-Ting with CSAC. All three of you have talked about difficult conversations involving multiple parties. Can you talk about a difficult conversation you had with one party? What was the most difficult conversation you've had, I don't know, in the last 3-4 years with one party? And you can name where the party was from. You don't need to name names. But what was the difficult conversation, and why was it difficult?
You know, when there's a case of somebody with organic brain syndrome or one of these other cases that falls through everybody's cracks, which we've of course had, they're all difficult conversations, and they all tend to be one-on-one, trying to figure out among the various providers, because there's these areas that are nobody's clear responsibility. So I'm just thinking of one where it was and actually it was a very positive conversation with Solano County. So since it was positive, I can say that, where they have some folks that have been in their mental health facilities for a long time that are now developing dementia or other things, and where we said, and actually it was the staff, I just sort of sat in the room and felt good, that yeah, we know. How do we help you? How do we get them what they need? But it could have gone a very different way, because these are very, very difficult cases, and the resources to serve them are not there. It's not even a matter of money. It's like even knowing what to do, it's very troublesome. So that's one example.
Okay, the most recent one I can think of was with a chief of police from one of my local jurisdictions, and we've been having this. Our cities are very different. We have Davis, which is like a university town. We have West Sac, which is like 50% poverty. And then we have Woodland, which is kind of like our county seat, but it's a little more agricultural, rural feel. So one of my jurisdictions is a little more risk adverse than any of the others. I will let you guess which one it might be. And we had been having this issue where we would have mental health clinicians out in the field do a 5150 assessment, and the police would show up and they wouldn't take the person into the hospital. So then we're left with a really hard decision. Do we stay with this client who we believe needs hospitalization for however long it takes? Do we transport them ourselves when we can't have handcuffs or a cage car? Or do we leave and fingers crossed, hope for the best? It's happened on multiple occasions with this jurisdiction, and we had a client take his life that we had called them out on. They hadn't taken him to the hospital. There were weeks in between the two incidents, but we were nonetheless not very happy with our local law enforcement partner, and so I had a pretty difficult conversation with that chief, and said, I'm pissed. Like, you let us down, you left us hanging, and now this guy's dead, and I kind of want to blame you guys for that. And he's like, you have every right to be mad. You know, they took this too far. I think our friends with guns are so scared to put their hands on any human being right now that they have overcorrected in terms of the pendulum. And so it was a pretty difficult conversation. There was obviously not a great resolution. I think we've agreed to partnering moving forward. We're going to their roll calls so they understand our role and theirs. He has agreed that even if his officers aren't comfortable putting their hands on our individuals we think need to be hospitalized, that they're willing to wait it out with us, whether that be a half hour or hours, in order to get them willingly to go into a vehicle or whatever the case may be. So I think that's probably the most difficult one I've had in a pretty long time.
Well, I have several a day. And I'd like to give you two examples, and one is frequently with the Board of Supervisors, and it's really around infrastructure challenges. When things fall through the cracks, when we're not adequately staffed, we're behind the ball, and I need to go before them and explain why I'm returning some dollars, or dollars weren't spent for mental health services when we know we need more. A good example is CHEFA dollars. It's really difficult to spend those dollars, and we've had some time to get it together, and we haven't gotten it together. So going before the board to explain really mishaps that are really purely connected to having an inadequate infrastructure. That's difficult. I always feel like I understand the issue much better every time I prepare for those conversations, but it's difficult because we just can't seem to get totally in front of it. I think the other conversation is when we make decisions daily about the most effective use of our limited dollars, and it impacts some groups more than it impacts others. A good example is we just recently changed a CSU, Crisis Stabilization Unit, which wasn't really functioning as a crisis stabilization unit for some time. It was being used as really urgent care for folks who needed medication. And it was serving about 6 people a day, 6 to 7 people a day. And they happened to be mostly your clients, and not mine. But they happened to be primarily African American. And as an African American person, the group is coming to me saying, "Can't believe you do that to black people." Now, all I could say is, do you know how much that's costing? And, oh, by the way, I have a better response over here, and a better, something that's a little more accessible. I had all the things thought out. But the most difficult conversation was that we were moving something that was familiar and comfortable for the community. So the stakeholder conversations are becoming more and more difficult because as our departments, you talked about penetration rate, and with the API communities, we're just doing poorly. And directly behind that are the African American communities. So those are really difficult conversations to have. And I think the other piece is that the difficult conversations to have, or that I have weekly, and I'm going to have one today at 4 with one of the senior staff, is really around we've got to do better. And when they feel like, and I know that they're working hard. They are really thinking about ways to get in front of this rolling ball. But we still have to do better. And so I think I want to wrap up this panel by saying, that I think we can do better. I think that it's there, and it always reminds me of I heard a story once, and I started telling it in prisons when I would go to graduations. Someone asked Michelangelo, "How did you get David out of that slab of marble?" And he said, "Well, David was always there. I just chipped away at everything that wasn't David." So I believe that we have the tools to do what we need to do. We just need to chip away until we get to that David. So thank you. Thank the panelists also.